Hey, welcome to Better Assholes, the podcast where we rip apart the crap society pretends to hold together with duct tape and good intentions. I'm your host, Sean, and today we're diving into a topic that's as decisive as it is personal: healthcare. Specifically, we're taking a hard look at the Canadian American healthcare systems. Now, what makes this conversation so juicy is the sheer hypocrisy and greed woven into these systems, from obscene executive pay packages to doctors and medical staff burning out. We'll peel back the curtain to see how much of it is about care and how much about cash. Yes, and we're starting with the recent shocking murder of a major insurance company CEO. So, let's strap in and get ready. And you know what? We don't have too much, sound effects and music here. So let's just, get to the point so we're not expecting too much. So let's talk about healthcare. Let's talk about North America. My specialty is North America. That's where I'm from. That's what I know, whether it's the US or Canada, one of those two systems. Now, as most people know, in Canada, it's universal healthcare, right? Everybody has access, it's publicly funded through taxes, and, no one's going broke paying medical bills. But, you might grow old waiting for your MRI, you might just die, or you might just consider euthanasia, which is a big topic now in Canada. It's Canada's very interesting. Wait times, you hear a lot about the wait times nowadays. We're kind of in a situation in Canada where you're waiting 2-3 years depending what's going on, depending what you need, depending where you are. CT scans, MRI scans, stuff like that is very hard in some places. Some provinces, some cities, they don't have hospitals with this type of equipment. So you have to go outside of your area. I've had some medical issues back in the days where, my options were, do I drive for 2 or 3 hours to go to another city to get treated, or do I just, kind of suck it up? A lot of people say, well, you maybe can't go to the hospital, but, you have doctors. Well, that's a real big problem in Canada as well. There are no doctors. Doctors want to make money, right? I think now as much as I'm a capitalist, everybody wants to make money. It's about the almighty dollar. It's about getting as much money as possible. And so when you become a doctor in Canada, you don't look at it as, I'm going to go save people, I'm going to go treat people. You look at it as, well, I'm set for life. I've got it made. I'm buying that Bentley. I'm buying that Lamborghini, whatever. And sometimes you start realizing, depending where you are, that you're very limited. Maybe a doctor in Canada might say, well, I'm going to, work under a medical practice or whatnot. They're, who knows, 150 grand, 100 grand, something like that, right? They're making six figures, but we're not talking, you're buying Lamborghinis. I've had some friends, and what they've done instead, they decided to open their own practice. They get an office, they, buy the space, turn it into a medical center, hire some other doctors, and, they reap those benefits. A lot of doctors, they look at what we have available here, and they make that decision to go to the US. It's a simple decision, right? Go to the US, make more money, have a better life, be able to spend some of that money. A lot of these doctors, by the time they get taxed here and you go through your expenses and whatnot, you got to think, if you're making 300 or 400 grand a year and you're limited to being taxed, you're losing 75% of your income, you're not getting anything out of it, and you still have to go across the states to go vacation or somewhere with warm weather, you're not going to go and really want to stick around in Canada all this time. So this is, the real big incentive for a lot of doctors in Canada to not be in Canada. That's kind of a problem, right? I'll tell you, in my city, I've been here close to 10 years, and I haven't had a family doctor. I had a family doctor for a year. And doctors here, they're very, I'll tell you, it's greedy. So if you're a doctor, they want to make sure that, they sign up people to their roster. They get paid by the government for the amount of people on their roster and each patient on their roster. They want to make sure that you're coming in for everything so that you get logged and they get a pay from it, right? So eventually it's less of they care about you, more hurting, right? We see that from the dental industry. Anything that's not government funded, you'll eventually see them. I'm glad that my eye doctor or my dentist is calling me, every month, every 2 months for an appointment, but it's just because they're making money. So if they weren't making money, $300 a visit, they weren't going to be calling me. They're not calling me because they care to see if my teeth are okay. They just want to book me in there, make their insurance company pay, and that's it. At the end of the day, they brushed my teeth for $300. I mean, for $300, I can brush my own teeth, right? And I'll do a really good job. So it's a bit different, right? It's basically one doctor for every 10,000 people. So in this particular city. So, people wait a lot. I've waited for different appointments up to 5 years. A lot of people will just go to Buffalo for an MRI. One of the jokes here amongst minorities is that once you go to the hospital, you're not coming out. So, you're stuck in a situation where you don't have confidence. How do you have confidence if you think that you have a limitation of surviving a hospital appointment depending on your background? And I mean, I guess maybe that's true. You walk in there, you're looked upon by doctors of a certain race, and maybe they say, hey, should we save this person? And we've had that happen with a lot of the Aboriginal people, Native people. They've had that problem. You hear that with Black people, with South Asian people, where they've had bad experiences. They don't get adequate care. So this is something that does happen. But at that point, I mean, when you're there for the money, you could understand that maybe you're picky about how you care for people, because it's, at the end of the day, when you have to hop in your Bentley and drive home, you don't want to smell like the homeless guy that just came in for whatever treatment that you have to get very hands-on with, right? So that's, stuff that happens there. What you've been seeing is, one of two things usually. So now you're seeing a lot of private doctors, and these are companies like Maple and TELUS Health that you pay a subscription to, or you buy a package to, and you call them. It's usually all remote, and you call them, you tell them your problem, they prescribe something to you, and you go on about your day. Now, I've used them a bit. I've used them extensively. I kind of use that service right now because there's a lack of doctors, but at least it's very convenient. And it reminds me of COVID times. At least I could call a doctor and say, hey, I have a problem. What can you do? Usually I get a prescription, I go on my way. Now, I'm somebody that studies. I study health. I study my health marks, my blood tests, my x-rays, whatnot. I know there's a lot of doctors that, they hate the Google doctors or whatnot, but, this is how people learn. It's funny because sometimes people like to act like you can never learn anything. A doctor is a person that picked up a book and had enough money, not time, but money, to be able to become a doctor. And so the regular Joe that can read and can sit there, and I mean, we're not talking about surgeries and specialties and whatnot, but your typical family doctor, which, I've gone into a doctor and the doctor hasn't been able to, help me much without using Google. So, I've been able to go home and do the same thing. And here I am, I'm alive and it's successful, right? The other thing Canada does here is MAID. So it's a system of euthanasia. You're able to apply for it. And basically at this point, it's blown up because it's an easy way for people with issues, sickness, disabilities, whatnot. I mean, eventually, listen, I was sick at some point. I was really sick. And you think the worst, right? When you're down on your health, you're not looking at it and thinking, hey, you know what? Next week this is going to get better. I'm going to go and swim in rainbows and unicorns, right? You're sick. Sometimes you don't want to be there. Sometimes there's a lot of negative thoughts and hard thoughts and times to go through, right? So a lot of these people are being taken advantage of by the government, just saying, well, we can euthanize and that will solve your problem. It doesn't solve anybody's problem. And that's a lot of families that are going to miss their family members and good times just based on, people dying just because they're fed up with the system. That's not even right. Back on script though, you know, when we look at the US, when we look across the border, it's a different beast. Healthcare is, largely privatized. If you got money or good insurance, you're golden, right? You get the best treatment. If not, you're screwed. I mean, that's the problem in the States, and that's what people are having a problem with. A lot of times in the US, a lot of, if you get sick, if you're majorly sick, if you're sick to the point where, you can't work, you're screwed. You're absolutely screwed. And you're basically dependent on GoFundMe. There's a lot of people whose life or death depends on GoFundMe. The difference, I think, with Canada and the US in this respect is that Canada it's an interesting system because if you had cancer in Canada, not just normal cancer, I mean, you had something maybe a little bit more sinister, all right? You had a worse cancer. What will happen is you go in for treatment. Everybody has the same treatment. It's all the same treatment everybody gets. So you're kind of stuck. You're not confident because you're not given any special treatment in terms of medicines or cure or whatnot. You're kind of, here you go. You're probably going to die, but we'll try to help you. So you're not left in a good position. If you said to the doctor, hey, you know what? I have all the money in my bank account. I have a great family. I have a great life. I want to live. I'll sell my house. I'll sell my car. I'll sell everything. I want to pay extra to live. I want to pay extra for those better treatments. I want a better medicine. I want a private bed. I'll pay for that. This is where we have the problem. In Canada, you're pretty much, it's like a social system. So in Canada, they believe if anybody has cancer, everybody's being treated the same way and everybody's chances are the same. So you're not going to get, a guy that's rich that walks in there with cancer and he has a better chance of surviving than somebody that walks in that's poor. This is problematic though, because I mean, there are some variables to it. And I mean, life isn't fair, but it is tough sometimes. I've had family friends and personal friends that have had cancer and other diseases, and they've been in a horrible spot, right? A lot of these people, they haven't had really an ability to have a chance to live because, whether it was money, the aggressiveness of their cancer or whatever, it was just, hey, we can't go beyond and above. They'd like to go to the US and American doctors say, hey, we could treat this, we could save your life. But, Canada's not going to pay for it. Ontario's not going to pay for it. The healthcare system in Canada is going to tell you to go and take a hike. So a lot of these people, they end up dead because they just don't have the option, right? It's tough. The US has specialized health centers. And, this goes back to surviving, right? The specialized health centers, the world-renowned technology, the experts, the procedures, you're going to live. It's super expensive, but you're going to live. If you have cancer, there's cancer centers, heart attack centers. You got arthritis, there's an arthritis foundation and centers and world-renowned just staff that have worked on world leaders, have worked on, CEOs and the richest people in the world. The rarest diseases have been worked on by American scientists and healthcare centers. However, it's just expensive, right? And there's a lot of people have gone bankrupt or they've killed themselves over the bills. They've been chased by creditors. People have had to change their names and move and leave the country. It's insane. And just to live, does it cost, $30,000 to fix a broken leg? I don't think so. But, somebody needs a Ferrari somewhere, right? So it is crazy. And, a lot of it comes up to our next point, it's the money trail, right? Let's talk about the cash. executive pay packages in healthcare are pretty obscene. Whether it's Canada, the US, insurance CEOs pulling tens of millions of dollars a year. A lot of doctors, we have doctors, six figures. We're talking from mediocre, 100, 200,000, $300,000 ranges into $500,000, uh, you know, doctors, $1 million doctors. This is pretty crazy. The healthcare centers themselves, they have their board of directors, they have their, different management staff. You go 3 or 4 deep of people making hundreds of thousands of dollars. So at this point, I mean, are you paying for the healthcare and the technology and whatnot, or are you paying for the doctors, right? Hospitals, nobody's pinching pennies. Nobody's pitching pennies anywhere except on the hospital themselves. Staff is, usually well taken care of, except the problem that you see now are nurses and some of the aides and whatnot, where they make, almost close to minimum wage, right? So it's a very interesting system. Now, how much of that money could actually go towards patient care instead of lining its pockets while patients wait for, months or years for procedures that could save their lives and improve the quality of their lives? We're paying CEOs, we're paying, doctors, we're paying, and it's not about people not deserving money. I mean, yes, you're a doctor, okay, you're saving somebody's life, you deserve a good pay. However, the difference between paying somebody, say, $500,000 as a doctor that does maybe a few procedures, a week to, maybe a normal, wage of somebody at a higher end in their in life. Paying somebody 100 grand. I mean, 100 grand is probably the norm now. It's almost like a minimum wage. You know, you're looking at some staff here where if you're paying 40 grand or 30 grand for a nurse, you're paying, you know, 200 grand or 300 grand for a doctor. You got to really see your money's worth out of that, right? I can see the nurses 40, 50 grand. That's not a lot of money. But when you start seeing the doctors, for how much the nurse takes in terms of their duties and what they have to do, their responsibilities, the doctor does a lot of that. Sure. Hands-on surgery or whatever, has that expertise. But, there's that gap there that I'm sure with a little bit of tightening, we can make healthcare a little bit more affordable, right? I don't want to get into healthcare budgets though, right? Maybe I'm talking up my ass here, but you see it. The doctor wants for his specialist, for his executive. Everyone wants to be rich. Social media shows us that we want to be rich. So we're just not. Nobody's saving anybody's lives anymore for free. It's very costly. The biggest thing here that people talk about in healthcare is always big pharma, though, and when you get into drug prices in the States, that's a huge issue as well. And there's that argument. There's a lot of research and innovation involved. I'll tell you, people don't understand how much research and the type of development, the type of innovation. There's just so much to it. There's so many scientists, and when we talk about people that deserve pay, you never see really scientists complaining. And they're all over these institutions, whether it's, hospitals, insurers, health centers. There are a lot of scientists, but they're never complaining. Those guys and girls there, they're doing, some amazing work. We're coming up with cures, vaccines, all sorts of science that's helping us live longer and take advantage of life in general, right? You look at things, and I don't want to put it out there, don't want to mention it, but right off the top of my head here, you look at stuff like biologic medicines, you look at Ozempic, that's big. Some people that would have always shout down skinny people now are the skinniest people, and that's just because they got a drug for it, right? This is all, really a bundle of greed when it comes to drug pricing and the healthcare industry and pharmaceuticals, doctors, this, that. A lot of it's greed. And part of it is if one person's doing it, another person's doing it, right? If the health center CEO is rich, the doctor wants to be rich, the pharmacy wants to be rich. And we mentioned this, right? So there's no point going on more about this, but you see how it is. It's a trend, right? Now, a lot of that we rambled. Why? Because there's so much to it. You could just bundle, it's like when you were a kid and you see your parents get into a conversation with other adults and everybody's just going, always politics, always religion, something like that. And this is very similar. Healthcare is like that. There's so much to it. We could keep going on. But, we're getting back to the patient experience, bringing it back to the people. What's it like to use these systems? Listen, in Canada, it's free at the point of care, but the wait times are just no joke. You need a specialist. You got to pack a lunch, pack a dinner. Bring some snack cakes because you're going to wait for months. This is why rich Canadians hop the border to the US for quick service and the ability to live longer. Because if you're stuck here, you'll wait for healthcare, you'll get in, and they'll do a crappy job and you'll die. Right? That's it. The average Joe stays in Canada, dies. Rich people, they go to US, their problems are solved. Now, in the US, the problem isn't the wait, it's the bill. A single trip to the ER could set you back thousands or tens of thousands. And people, they're not worried about getting better. They're worried about going bankrupt. There's people that go to the doctor in the US as a last resort, absolutely last resort. They say, you know what? I'm going to die right now. This is my last chance. And they go to the hospital in the minutes before their death, just because at that point you understand that you need help and it's worth it, that you're going to lose everything, but maybe you'll survive. And it's that desperate moment. And that's what's happening, right? We have the technology, the experience, the skills to save more people every day, but it's just not profitable. It's just the bottom line. It's just not profitable for us to save people, right? The doctors are burnt out. They're overworked. And this goes for nurses too, overworked, undersupported, and a lot of them haven't signed up for it, right? Saving people is one thing. We talked about a lot of these guys are in it for the money, but I mean, a lot of us burning out in the US because, you have now so many issues, especially after COVID, requiring, you know, healthcare professionals. You have a lot more people that are, coming into the country, being born, needing assistance. You have a lot of more seniors. As the economy goes bad in some places, you're having people that can't afford to maintain their health. And you're seeing that now. And it's really making a lot of stress for doctors, nurses, the healthcare system, both Canada and US. Right. So it's a lot of burnout. So it's hard to be, in any situation. And as a patient, it's tough. You're waiting forever. You go into the ER. Now the ER is, gone from 5 people with emergencies to 50 people because there's no other way to get in the hospital. There's no other way to see a doctor. If anything happens, you have no way of getting better, seeing somebody unless you go through the ER. So ER times are up. I know some of the hospitals here, I mean, having to go in there and you check the waiting time, 4 hours, 8 hours, 2 hours, 16 hours. One guy here he died after waiting, I think something like 40 hours for a hospital, right? To get an ER. And he just basically died in the waiting room and nobody noticed until it was finally his number and they saw him dead. So it's tough, right? This goes back to what we kind of touched a little bit at the beginning. And that's a lot of the recent developments. I think just my reason for this episode here and just, having an interest in this has to be the most recent developments. And healthcare is something I've wanted to talk about for a while. And there was not a lot of people that understood because they had to be in the situation of experiencing it to understand. And so what we have just recently seen, right, which is the elephant in the room, was a recent murder of a major insurance company CEO. Now, it's just not a headline, it's a wake up call. A frustration with the system has hit a boiling point. People feel like they've been squeezed dry. Right? And honestly, they're not wrong. So just a few days ago, the United Healthcare CEO, Brian Thompson, was gunned down by somebody that, by a suspect that now they're looking at the possibility that he had health issues and, maybe had some denials or had some claims with the insurance company. I think a lot of people now are having this type of frustration because they see, this goes back to what we talked about before. The CEO with his Lamborghini or her Lamborghini pulling out the parking lot. If his or her family member was sick, they're going to get cured right away. Right? Funny enough, the doctor that will not say give you a prescription or check you out thoroughly or is on the fence about, treatments for you, if their family was in that situation, they'd be treated immediately. So just always keep that in consideration that, a lot of people feel that, hey, we have the CEO making tens of millions of dollars, that nothing could ever go wrong in their lives. And I'm in pain because I go to the doctor and I can't get Tylenol or whatever, right? I can't get a prescription. I can't get, the screws in my back. I can't get a fake leg, whatever it is. This is what people are happening now, right? So, there's a lot of threats now against insurers, against all the CEOs of healthcare companies and pharmacy companies, right? And they're growing louder. And now it's like people are saying, if you're not going to listen to us, we'll make you listen. And violence is an answer, but the sentiment behind it is worth exploring, right? You hear over the last few days, companies are pulling down their about us on their webpage, their executive profiles. CEOs are getting security at their residence, security is being beefed up there at their work. And there's a lot of major concerns about it because, it is going to happen where there are going to be copycats. There are going to be people exploring the same type of frustration that are going to say, hey, you know what? For what it's worth, I'm going to take this into my own hands. And, the more that we make people, we put people in this situation, the more we are going to see it. Because if you don't have anything to live for, it makes it very difficult to watch people that have everything to live for and they built that on your back. Keep that in mind. So what have we learned today? That healthcare in both Canada and the US is broken, just in different ways. In Canada, you might die waiting. In the US, you might die because you can't afford to live. You can't afford to pay your bills. Either way, the system isn't about cure, it's about cash. Canada has euthanasia now instead of curing you. And the US, well, the sky's the limit. As long as you have the cash, everything is curable. Here's the kicker. These systems don't have to be this way. Greed, profit, bureaucracy has twisted healthcare into something unrecognizable. The question is, what are we going to do about it? The people. Thanks for tuning in to Better Assholes. If this episode made you think, or if you've got a healthcare horror story to share, hit me up on social media. Until next time, stay curious, stay skeptical, and most of all, stay better assholes.